You'll often meet patients who have convincing angina, abnormal stress results, and clean coronary arteries on angiography or coronary CT. That pattern points to ischemia or angina with non-obstructive coronary artery, abbreviated INOCA or ANOCA. It's common especially in women, and it carries real risk. In these patients, the problem isn't a major blockage in a large coronary artery. Instead, the issue often lies in the small vessels, in abnormal vasomotor tone, or in a combination of the two. What matters for us during an exercise stress ECG is recognizing the electrical and symptomatic clues that point toward this pattern. On the ECG, the changes can look very similar to ischemia from obstructive coronary disease. You may see horizontal or downsloping ST segment depression of 1 millimeter or more in 2 contiguous leads. These changes may appear at lower workloads than expected, and they may persist into recovery, which can be especially informative. Sometimes, the clearest evidence of ischemia in these patients shows up on the 1 or 2 minute recovery tracings, when motion artifact settles and the ST segment becomes easier to evaluate. Symptoms provide another important clue. Patients with ANOCA often experience classic angina during exercise, pressure tightness, shortness of breath, or symptoms that feel similar to their prior episodes, even though their arteries appear free of major stenoses. Their symptoms may begin earlier in exercise or may feel out of proportion to the workload. Some may also describe angina that continues briefly into early recovery rather than resolving immediately. Their overall physiological response during the test can offer hints as well. They may have lower exercise capacity than expected for their age and sex, or they may show an exaggerated blood pressure response or unusually slow heart rate recovery. These findings don't diagnose INOCA on their own, but they support the overall pattern when paired with symptoms and ST segment changes. In your report, it's important to name what you see. Instead of calling the test normal, describe it accurately. For example, exercise ECG demonstrated horizontal ST segment depression in the lateral leads with typical angina symptoms in the setting of non-obstructive coronary arteries. Findings are consistent with ischemia with non-obstructive coronary arteries. Recognizing this pattern matters because these patients are not low risk just because their arteries look normal. Identifying ANOCA or INOCA during stress testing helps guide appropriate follow-up and prevents these patients from being told nothing is wrong.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how Medmastery can help you become a great clinician, make sure to watch the About Medmastery video. So thanks for watching, and I hope to see you again soon.